When it comes to mood disorders, the layperson's understanding often stops at the word depression. However, within the medical community, it is well understood that not all depressions are created equal. A particularly important distinction exists between unipolar and bipolar depression. These two disorders, while sharing a common symptom of depressed mood, are vastly different in their diagnostic criteria, symptomatology, and treatment protocols. To understand these nuances, we look towards the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, as a foundational reference. It is important to understand the diagnostic criteria according to DSM-5. According to the DSM-5, the diagnosis of unipolar depression, also known as major depressive disorder, requires the presence of at least 5 specific symptoms over a 2-week period. These symptoms include a depressed mood, a noticeable loss of interest or pleasure in almost all activities, significant weight changes, sleep disturbances, fatigue, feelings of worthlessness or excessive guilt, a diminished ability to think or concentrate, and recurrent thoughts of death or suicidal ideation. The absence of any manic or hypomanic episodes is essential for this diagnosis. Bipolar depression, on the other hand, is a component of a broader condition known as bipolar disorder. According to the DSM-5, a diagnosis of bipolar disorder requires the patient to have experienced at least one episode of mania or hypomania. The criteria for a manic episode include a period of abnormally elevated, expansive, or irritable mood lasting at least 1 week, accompanied by at least 3 additional symptoms like inflated self-esteem, decreased need for sleep, increased talkativeness, and others. Let's have a comparative look at symptom manifestation and intensity. Let's start with unipolar depression. Patients with unipolar depression predominantly experience episodes of depressed mood. The intensity of their symptoms varies but rarely reaches the extreme mood fluctuations seen in bipolar disorder. They do not experience manic or hypomanic episodes, which are characteristic of bipolar disorder. In contrast, those suffering from bipolar depression experience cycles of extreme mood states, from depressive lows to manic or hypomanic highs. These dramatic shifts often result in severe disruptions in daily life, relationships, and occupational functioning. When it comes to medication, unipolar depression is commonly treated with selective serotonin reuptake inhibitors like fluoxetine or sertraline. These medications act by increasing the levels of serotonin, a neurotransmitter associated with feelings of well-being and happiness. Bipolar depression, however, often requires a more complex treatment regimen. Mood stabilizers like Lamictal, Trileptal are usually the first line of treatment. Lithium or valproate can also be used for treatment-refractory cases. Atypical antipsychotics like Seroquel, Vraylar, and Latuda may also be prescribed for mixed manic cases. That is, the person is having symptoms of depression and mania simultaneously. Cognitive behavioral therapy is widely effective for treating both unipolar and bipolar depression. However, the approach is usually tailored to suit the specific needs of the patient, depending on their diagnosis. For instance, CBT for bipolar disorder often involves educating the patient on recognizing the early signs of mood shifts. Interpersonal and social rhythm therapy helps bipolar patients form healthy coping skills. Watch my video on interpersonal and social rhythm therapy on my bipolar playlist. For bipolar disorder, additional interventions like electroconvulsive therapy may be considered, especially in severe or treatment-resistant cases. Understanding the clinical differences between unipolar and bipolar depression is crucial for both accurate diagnosis and effective treatment planning. While both disorders share the common symptom of depressed mood, their diagnostic criteria, symptom intensity, and treatment options differ markedly. Therefore, clinicians, patients, and families must be well informed to navigate these complexities successfully. Thank you for your time. If you enjoyed this video, visit my website for more content.